Hello, everyone. Thanks so much for tuning in today to get some great highlights about the 2021 Target BP Recognition Program. My name is Joe Pinto, and I'm a practice transformation specialist here at Quality Insights. And I'll be interviewing Sue Chute, the CEO of Multicultural Health Evaluation Systems in Erie, PA, that is our champion practice as part of our hypertension and diabetes control and prevention initiative. We also assisted MHEDS with their submission to the 2021 Target BP Recognition Program. And Sue will be sharing with you some of the common challenges that practices face in regards to hypertension control within their patient population and the strategies they employed to combat these issues. We'll then wrap it up with some great lessons learned, as well as guidance on how your practice can enhance its blood pressure management efforts. So what is the Target BP Recognition Program? Target BP is a national initiative formed by the American Heart Association and American Medical Association to improve blood pressure control rates and change the trajectory of cardiovascular health in the U.S. Joining Target BP signifies your commitment to help and to reduce the number of Americans living with uncontrolled blood pressure. The Target BP Recognition Program celebrates physician practices and health systems who treat patients with hypertension for achieving blood pressure control rates at or above 70% within the populations they serve. There are 4 recognition levels of achievement: gold, gold plus, silver, and participation levels of recognition. These achievements will ultimately lead to a reduction in the number of Americans who suffer heart attacks and strokes. The AHA and AMA are thrilled to recognize over 1,000 organizations for calendar year 2021. Multicultural Health Evaluation Systems is an FQHC lookalike with 2 practice locations in Erie, Pennsylvania. MHEDS is Northwest Pennsylvania's one-stop healthcare service provider serving Erie's multicultural community. They offer medical treatment, education, support services, and top-quality curative and preventative care. And their services are offered regardless of a patient's ability to pay. Thank you so much for joining us today, Sue. And can you please give us a little background about the work that you do with this practice?
Sure, Joe. I joined MHEDS in 2019, and at the time I was an MPH student at Slippery Rock University. My project with MHEDS was developing an ethnic diabetes self-management and support program. Diabetes is a really common diagnosis with our patient population, and diabetes education is critical in helping them manage their blood glucose. Most of our patients come from different parts of the world where their cuisine and cultural practices are very different from the typical American diet, so they didn't connect with the traditional diabetes self-management and support classes. We designed classes that are presented in their own languages and include their ethnic foods, cultural, and religious practices. And we've had really positive feedback from our patients. Since then, I've continued to work with our diabetes program and also many other projects. As you know, diabetes and heart disease are very closely associated, so improving how we manage hypertension is an important piece of good diabetes care. At MHEDS, hypertension is the #1 diagnosis, with almost 30% of our adult population having this diagnosis. That resulted in over 1,100 patient visits in 2021, so you can see that there's a big need for hypertension management. As an FQHC lookalike, MHEDS has to monitor hypertension control and several other clinical quality measures regularly and send data to HRSA at the end of each calendar year. Quality improvement projects are often targeted at improving these measures. Hypertension control is a measure that MHEDS has worked on through initiating a patient home monitoring program and developing a blood pressure protocol to eliminate variation between clinicians and our 2 sites.
Excellent. And Sue, being the Chief Operating Officer, would you please tell us a little bit more about some of the common hypertension control challenges that MHEDS faces within its patient population and how you are able to overcome these issues?
Our patients really do face a number of barriers for good hypertension control. Because they come from all over the world, language is the biggest barrier. We provide both in-person and video interpretation for our patients who need language assistance. Many of our staff come from the communities that we serve, so they're really helpful in assisting with scheduling and then interpreting during those appointments. Another problem is literacy, general literacy, and health literacy. Because many of our patients lived in refugee camps and were fleeing war zones, many were unable to complete their education. So patient education about their health conditions and their care plan is challenging. Even with translated handouts, sometimes our patients are unable to read their own languages. So you can see how complicated this would make some issues such as medication management. For example, we've had many times that patients don't understand how to take their medications properly. If it says take 3 times a day, they might take it all at the same time. They don't really understand the spacing. And another thing that's happened is they don't understand that it should be refilled when it runs out. They figure when it's finished, then their problem is fixed. So we really do have to do a lot of education with our patients. In addition, they don't understand our healthcare system and the importance of preventive medicine. If they don't feel sick, they don't understand why they should see the doctor. So things like well visits and hypertension checks are sometimes difficult to schedule or even end up being canceled. But having staff members who are trusted members of the community is really critical in helping our patients navigate the health system. In fact, we are right now in the planning stages of providing community health worker training to many of our interpretation staff so we can increase the roles that they can play in assisting patients with medication management, chronic condition management, and patient education. And finally, access to technology is also an issue with our patients. For many of them, their cell phone is the only access to the internet that they have. We are now able to offer our patients high quality home blood pressure monitors that we've received through our partnership with Quality Insights. In addition, we have purchased iPads for patients and providers to use during telemedicine visits and educational visits.
Excellent information. And what made you decide to submit an application for the Target BP Recognition Program this year?
Well, we've been working with Quality Insight for several years on a number of projects, and including hypertension control. And when you brought this recognition program to our attention, we wanted to be a part of it. We understand the importance of this initiative. We know that we've done the work to improve hypertension control with our patients. So applying for recognition is a logical step for us. And we want to show the Erie community the good work that we do.
I'm happy to hear that the work that you're doing on behalf of the programs that we provide here at Quality Insights has been so beneficial. And Sue, from your perspective then, how difficult or time consuming was it to complete the application process?
I found the process to be really straightforward. It was simple and fast once I gathered the data that I needed to fill out the online application. The support that we got from Quality Insights made it really easy for me to complete everything, and all the links that you provided us for resources helped me to complete the process with ease.
Okay, and then what guidance or resources can you offer that you found were the most beneficial?
There's many resources on the Target BP website that can make the application process simple. The Target BP Recognition Program Data Collection Requirements document was one of them. It was really useful to look ahead of time and gather all the data I would need to put into the online form. It just made the application process go much more simple to have the data at my fingertips. In addition, there's a program quick user guide that really helps with the online submission part. It kind of walks you step by step through the entire application process online.
Great. In addition to the quick user guide, were you able to use any of the resources such as the videos to guide you through the submission process?
I did watch the video that was titled How to Submit Data for Target BP Quick Overview. Between that and the quick user guide document, I did not feel the need to watch the more detailed video walkthrough, but it is available on the Target BP website and easy to find. Just go on the website, click on recognition, scroll down, and all of the documents and videos are available on that page.
Great. And I'm glad to hear that you found the resources to be a valuable tool to help you through that process. So in addition to that, have you been notified at all as to which level of recognition your practices are going to receive?
I had not heard anything back from Target BP, so I reached out and asked them if there was any determinations made yet. The response I got was that they will not announce recognition levels until September or October this fall.
Okay. And then one other question regarding the process. How seamless was the data submission process on your end?
I thought it was very smooth. The first step was getting registered with the American Heart Association and then selecting the Target BP program. Then they sent login credentials for me to access the online data portal to submit the data. And again, as I said earlier, once I got the data from our IT department and I got everything ready ahead of time, filling out the application was pretty simple.
Excellent. And thank you so much for filling our viewers and listeners in on this valuable information. So to wrap things up, Sue, what advice do you have for other physician practices who might be interested in improving their blood pressure control rates and also in completing the application for Target BP's recognition program next year?
Well, there's really so many resources available to help organizations that are interested in doing a quality improvement project for hypertension control. The Target BP website offers more resources than just how to apply for recognition. There's resources for staff training, how to set up a home monitoring program, current guidelines, current best practices, and more. So my advice is to start there and really consider partnering with Quality Insights for up-to-date information, resources, and support throughout the whole process. Once you've done the hard part, which is making those changes to your program or protocol, don't be afraid to try applying for recognition. That's the easy part. And it's really great for your clinical and quality improvement staff to get the recognition that they deserve.
Well, thank you so much for this great information, Sue. I appreciate you willing to participate on this valuable podcast this morning. And we all know that hypertension management is so very vital to the people who suffer from this chronic condition. So make blood pressure control the goal. Quality Insights encourages you and your care team to implement new strategies and workflows to improve hypertension management within your practice. If you would like more information about the programs and support that we provide, please visit our website or feel free to contact us here at Quality Insights at 1-800-642-8686 to take advantage of our no-cost assistance. Congratulations again to Multicultural Health Evaluation Systems for being named 2021 Target BP Recognition Program champions. This is a tremendous accomplishment, and we are so very proud of the work that you've done to achieve this national recognition. So keep up the excellent work. Thanks so much for listening to this podcast. We hope that you picked up some very useful tips and information, and we'll see you again on a next session. Perfect.